Before anesthesia, surgery was agony. Whiskey numbed the mind, but not the pain. Then a few daring doctors discovered something that would change medicine forever. Imagine a small tiered room packed with onlookers, students, citizens, and fellow doctors. In the center, a patient lay on a table, often held down by several strong assistants. It was a room filled with sound, the sharp clang of metal on metal, the low murmur of a crowd, and then the main event, the scream. Surgery before the mid-19th century was an act of controlled violence. Tools were heavy, often ornate, built for brute force and speed. A shot of whiskey might be offered, or opium. Powerful, but not an anesthetic. They dulled memory, not sensation. The body still felt every slice, every saw stroke, every pull of the forceps. Speed was the surgeon's greatest skill, but the only mercy he could offer. Venturing into the body's cavities was considered a death sentence. This was the world before the quiet, before a patient could be gently guided into a temporary sleep. In smoky laboratories and dusty apothecaries, a few curious minds began to play with the very air people breathed, unknowingly moving toward one of medicine's greatest discoveries. In the late 1700s and early 1800s, scientists were obsessed with new gases. One pioneer was the English chemist Humphrey Davy. Around 1799, he experimented with nitrous oxide, laughing gas, and carefully documented its effects. He wrote that nitrous oxide may probably be used with advantage during surgical operations. The world wasn't ready. The gas became a spectacle, more entertainment than medicine. In 1818, Michael Faraday noted that ether vapor acted like nitrous oxide. Another piece of the puzzle. The science was there, whispered in lab notes and journals. What was missing was a bridge, not someone to carry the idea from lab to operating table. In the 1840s, dentistry was brutal. Pulling a tooth meant forceps, leverage, and a patient wide awake. William T.G. Morton, a young Boston dentist, sought a better way. He turned to ether, a volatile, sweet-smelling liquid turned vapor. He experimented on insects, his dog, then himself, feeling a spreading numbness. On September 30th, 1846, Eben Frost agreed to inhale ether for a dental extraction. He slept. The tooth was removed. Waking, Frost said he had felt nothing. Not a twinge, not a pinch. Morton knew this was bigger than dentistry. He sought a grand demonstration. The grand stage was set for October 16, 1846, at Massachusetts General Hospital. The ether dome filled with surgeons and students. Skeptical, arms crossed, the patient, Gilbert Abbott, faced removal of a neck tumor. Dr. John Collins Warren would perform the operation. Morton entered, carrying a strange inhaler to deliver ether vapor. He instructed Abbott to breathe deeply. The room fell silent. After minutes, Abbott's body relaxed, his eyes closed.
Sir, your patient is ready.
Warren made the first cut. The crowd waited for the inevitable scream. But there was no scream, no struggle. Warren continued, carefully dissecting as the theater held its breath. Skepticism melted into awe. They were witnessing a dawn. As the wound was dressed, Abbott began to stir. Calm. Alive. Painless. Dr. Warren faced the stunned room and delivered his verdict.
Gentlemen, this is no humbug.
News spread by letter and telegraph. Within months, London, Paris, and beyond adopted ether. Before 1846, surgery meant terror. After, it promised hope. Ether wasn't perfect, unpungent, irritating, and dangerously flammable. In 1847, James Young Simpson championed chloroform, more potent, faster, and easier to tolerate. He used it in childbirth, controversial but popular. But these drugs could kill as easily as they could heal. Skill and judgment became paramount. A new specialty emerged. The anesthetist. Watching, breathing, pulse, and color. The OR transformed from chaos to coordinated calm. With pain quelled, surgeons could slow down, to think. They entered the abdomen, the chest, the brain, in once forbidden territories. From appendixes to gallbladders to tumors, precision replaced haste. Complex operations took hours instead of minutes. Today, anesthesiologists use cocktails of drugs and precise machines to keep patients safe and still. Hospitals became schools. Teams trained together. Surgeons, anesthesiologists, and nurses. The brutality of the past gave way to science, safety, and precision. Chloroform carried hidden risks, liver injury, and sudden cardiac arrest. New drugs followed, barbiturates to induce sleep, then safer inhaled agents like halothane. Muscle relaxants kept bodies still without dangerously deep anesthesia. Cloth and bottle gave way to machines that meter gases precisely and monitor every breath. Airways secured, oxygen delivered, carbon dioxide tracked. Anesthesia became an exact science. Anesthesiology matured into a specialty. Pharmacology, physiology, and critical care combined. Plans are tailored to age, weight, history, and the surgery's demands. And for healthy patients, anesthesia is now extraordinarily safe. From heart bypass to kidney transplant, confidence replaces fear at the OR doors. Children face procedures without terror. From Boston, knowledge spread worldwide, a universal standard of care. Modern innovations, from organ transplants to robotics, all depend on stillness and freedom from pain. It was built by chemists, dentists, and surgeons, and curiosity, ambition, and compassion aligned. Anesthesia didn't just stop pain, it opened the door to miracles. Anesthesia silenced the pain, and in that silence, a new and kinder age of medicine was born.